I'm talking today about poetry as therapy. Now, if you're already in the classroom, if you're a teacher or a paraeducator, you are fully aware of the power that there is in the writing process, the power of the written word and expressing that in a creative way. If we are talking about that in the context of a trauma-sensitive setting, we can take that a step further. We can be planful and deliberate and create writing strategies that will really facilitate healing for the student. It can become a part of their trauma narrative, which is something that when students are engaged with a therapist or a social worker or a counselor, they usually take that step to write a trauma narrative, which occurs over a number of weeks or months. It can take even longer. It is a process, and you don't just sit down and write that in one sitting. So this poetry can become a part, can become like a link or a step in that trauma narrative process. So it's really powerful when we are able to collaborate with the student's therapist or counselor and be in communication about what the child is writing and what the responses are and how that's looking within the context of their treatment and their treatment goals. Now, some of you might be working with students who haven't really been identified as having, I should say officially identified as having a high score on the ACEs scale, a number of adverse childhood experiences. And so maybe they're not working with a therapist, but you can still do some of this good work to help expedite some healing, some processing. And we are going to be talking to one of our on-campus therapists. She can give us more insight and more direction in how to provide this activity for students, allow them to employ this strategy and make the most of it. I'm here with Kirsty Ruggles. She is a clinical interventionist and trainer here at Chaddock School. Kirsty, thanks for coming. Mm-hmm. All right, Kirsty, we really enjoy writing activities of all sorts. Mm-hmm. We enjoy all sorts of creative expression activities, and we really enjoy poetry writing. And I know that we see that it has some really meaningful therapeutic effects and implications. Mm-hmm. So can you talk to me about what that looks like in terms of therapy, a therapeutic strategy in the classroom, and how that can kind of fit into the student's trauma narrative?
Okay, well, so I'm actually I enjoy writing as a way of coping when my life is stressful. I find that it helps me to, clear my thoughts, to put things into perspective. And so I think that using, poetry or any kind of writing with our students is really helpful for them. And for a lot of our students, or at least for some of them, they struggle to put their feelings into actual words, and it's painful for them to speak their words out loud. And so by offering them this outlet of writing poetry, you are giving them a chance to really express themselves without it becoming kind of a shaming experience for them, because a lot of them already experience a lot of shame with their experiences that they've had. And so I think that it's a really great tool to use with our students, to let them express themselves in ways that doesn't include having to stand up and say what's happened to them. Mm-hmm. And so I think go for it. I think it's a great idea, great tool.
Great, thank you. Are there any pitfalls we should kind of be on the lookout for? Anything we should or shouldn't do or say?
Well, I think whenever you are working with any student who has experienced something traumatic for them, and remembering that trauma is subjective, so what they have experienced as traumatic may or may not be traumatic for us. So first of all, we have to remember that the things that they talk about or suggest are very real to them. Even if we think, well, that doesn't sound very dangerous or scary, for them it was real. So I think making sure that if you do a session like this where you're asking the students to express themselves, particularly about their traumas, is to be very kind of open-minded and patient with them. I think preparing them, perhaps practicing some coping skills, like I know you do mindfulness, meditation, practicing those skills before you attempt to have them explore their trauma, because they are going to need those skills as they do this activity with you. And so that you can say to them, hey, remember, hey, if you need a break, you can, do some meditation or do some mindfulness. Because we don't want them to leave the classroom in a more stressed state than what they entered it into.
Exactly. And maybe even following up again with that same meditation when you're finished.
Yep, checking in. So even, practicing a coping skill before, remind them to use it during, and then doing it again at the end.
Okay, perfect. Oh, this is so helpful. Thank you very much.
You're welcome.